Question 1. What is the primary role of the Registered Behavior Technician, RBT, in the behavior analysis service delivery system? A. To design behavior intervention plans. B. To supervise other RBTs. C. To directly implement behavior plans designed by a supervisor. D. To conduct functional behavior assessments independently. Answer: C. To directly implement behavior plans designed by a supervisor. This question asks about the RBT's main job within the behavior analysis team. The keyword primary role tells you to focus on the RBT's core responsibility. RBTs are frontline staff. They work directly with clients following plans created by their supervisor, who is usually a BCBA or BCABA. RBTs don't create the plans or assess why behaviors happen on their own. They carry out the strategies. Think of it like following a recipe. The supervisor creates the recipe, and the RBT is the chef who follows it carefully. Your main job is to put the plan into action exactly as your supervisor instructs. Question 2. Which measurement method would be best to use if you want to count how many times a specific behavior occurs within a session? A. Duration. B. Frequency. C. Latency. D. Whole interval recording. Answer: B. Frequency. This question is about different ways to measure behavior, and the key phrase "count how many times" points directly to the concept of frequency. Frequency is simply a tally or count of how often a behavior happens during a specific time period. Duration measures how long a behavior lasts. Latency measures the time between a cue and the start of a behavior, and interval recording involves checking if a behavior occurs within intervals. If you need to know the total number of times a child says "please" or throws a toy, frequency is the way to go. It's like counting apples in a basket. You just tally each one. Remember, frequency is all about the count. Question 3. What is a reinforcer? A. A consequence that decreases the likelihood of a behavior happening again. B. A neutral stimulus that has no effect on behavior. C. A consequence that increases the likelihood of a behavior happening again. D. A signal that a behavior will be punished. Answer: C. A consequence that increases the likelihood of a behavior happening again. This question defines a core concept in behavior analysis: reinforcement. The crucial part of the definition is that a reinforcer is something that follows a behavior, a consequence, and makes that behavior more likely to occur in the future. It's not about whether the consequence is good or bad from a moral standpoint, only about its effect on the behavior's future rate. If a child gets extra playtime after finishing their homework, and they are now more likely to finish their homework in the future, the extra playtime is a reinforcer. Reinforcement strengthens behavior. Question 4. When implementing a skill acquisition plan, what should the RBT do first? A. Implement the teaching procedure immediately. B. Gather the necessary materials and review the plan. C. Determine the function of the behavior. D. Modify the plan based on client progress. Answer: B. Gather the necessary materials and review the plan. This question focuses on the practical steps an RBT takes when starting to teach a new skill. Before you can teach anything effectively, you need to be prepared. Reviewing the plan ensures you understand the steps, goals, and materials needed, and gathering materials means you have everything ready before you start working with the client. You can't teach a matching task without the matching cards, or teach hand washing without soap and water readily available. Preparation is key before you begin teaching. Always get ready before you start. Question 5. Discrete trial training, DTT, is a teaching method that involves breaking down skills into smaller steps and teaching them one at a time. What is a typical trial structure in DTT? A. Presenting multiple instructions at once, then providing a consequence. B. Natural opportunity to respond, response, consequence. C. Discriminative stimulus, SD, response, consequence. D. Modeling the skill, Client attempts, feedback. Answer: C. Discriminative stimulus, SD, response, consequence. This question describes discrete trial training, DTT, and asks about its basic building block, the trial. The core structure of a DTT trial is presenting a clear instruction, or cue, the discriminative stimulus, or SD, the client giving a response, and then providing a consequence based on that response, like reinforcement for a correct response or a specific procedure for an incorrect one. It's a structured way of teaching. For example, the SD is touch red. The client touches the red block, response, and you say, "That's red. Good job." Consequence. Remember the sequence. Cue, response, consequence. Question 6. What is the purpose of collecting data on a client's behavior? A. To keep the client busy during sessions. B. To prove to parents that the RBT is working. C. To make informed decisions about the effectiveness of the intervention. D. To determine the client's diagnosis. Answer: C. To make informed decisions about the effectiveness of the intervention. This question is about the fundamental reason why RBTs spend time collecting data. Data isn't just busywork, it's information. By tracking how often a behavior happens or how well a client performs a skill, the supervisor can see if the teaching methods or behavior plans are actually working. Data helps everyone on the team see progress or identify if something isn't working and needs to be changed. It guides the decisions about what to do next. Data helps you know if you're on the right track. Question 7. Which of the following best describes the concept of extinction in behavior analysis? A. Providing reinforcement for a desired behavior. B. Withholding reinforcement for a previously reinforced behavior. C. Giving a client a break from instruction. D. Applying a punishment procedure. Answer: B. Withholding reinforcement for a previously reinforced behavior. This question asks about extinction, which is a strategy used to decrease behavior. Extinction works by stopping the reinforcement that was previously maintaining a behavior. If a child cries to get a toy, and you used to give them the toy when they cried, extinction would involve not giving them the toy anymore when they cry. This makes the crying less likely in the future because it no longer works to get the toy. Extinction is about cutting off the reward that fuels the behavior. It's like turning off the water supply to a plant. The behavior, plant, won't be able to grow without the reinforcement, water. Question 8. What is the term for providing a client with assistance to complete a task or perform a skill? A. Reinforcement. B. Punishment. C. Prompting. D. Extinction. Answer: C. Prompting. This question asks about giving help to a client. When we talk about assisting a client to get the correct response, we use the term prompting. Prompts can be physical, like guiding their handy, gestural, pointing, verbal, telling them the answer, or visual, showing a picture. Reinforcement is a consequence that increases behavior, punishment decreases it, and extinction involves withholding reinforcement. Prompts are about making it easier for the client to do the right thing so you can reinforce it. Prompts are your helping hand. Question 9. When is it appropriate for an RBT to discuss a client's confidential information? A. With anyone who asks about the client. B. With family members not involved in the client's care. C. With the RBT's supervisor and other members of the treatment team. D. On social media to share progress. Answer: C. With the RBT's supervisor and other members of the treatment team. This question is about client confidentiality, a very important ethical responsibility for RBTs. You must protect your client's privacy. You can only share information with people directly involved in the client's care and who have a professional need to know, primarily your supervisor and approved team members. Discussing client information with unauthorized people, even family members not on the treatment team or on social media, is a serious breach of ethics. Keep client information strictly within the professional team. Privacy is key. Question 10. What is a functional assessment designed to determine? A. The client's IQ. B. The function or purpose of a behavior. C. The client's preferred reinforcers. D. The client's medical diagnosis. Answer. B. The function or purpose of a behavior. This question asks about the goal of a functional assessment. The term functional here refers to the purpose or outcome of a behavior for the individual. Behavior happens for a reason. A functional assessment helps the supervisor figure out why a client is engaging in a particular behavior, what they are getting from it, or what they are avoiding. Is it to get attention, to get a tangible item, to escape a task, or does it feel good, sensory? Understanding the function is crucial for creating effective behavior change plans. Function tells you the why behind the behavior. Question 11. If a behavior plan requires you to use a timeout procedure, what should you do before implementing it? A. Try a less intrusive procedure first. B. Get permission from the client. C. Review the behavior plan with your supervisor and understand the specific steps. D. Ask the parent if they think it's a good idea. Answer. C. Review the behavior plan with your supervisor and understand the specific steps. This question is about implementing behavior reduction procedures, specifically timeout, before using any intervention, especially one designed to decrease behavior. You must fully understand the plan and procedure exactly as written by your supervisor. Behavior plans are specific and must be followed precisely for safety and effectiveness. Timeout procedures have very specific steps, like duration, location, what to do if the client tries to leave, that you need to know cold. Don't guess. Always review and clarify with your supervisor. Clarity and precision are essential. Question 12. Which of the following is an example of indirect measurement? A. Counting how many times a behavior occurs. B. Using a stopwatch to time how long a behavior lasts. C. Conducting an interview about a behavior. D. Observing a behavior as it happens and recording it. Answer. C. Conducting an interview about a behavior. This question asks about different ways to gather information about behavior, specifically indirect measurement. Indirect measurement involves getting information about behavior without observing it directly as it happens. This often means talking to people who know the client well, like parents, teachers, or reviewing records. Counting, timing, and directly observing are all forms of direct measurement, where you are measuring the behavior in real time. Think of it this way. Direct is seeing it yourself. Indirect is hearing about it from someone else. An interview is an indirect way to learn about behavior. Question 13. What is stimulus control? A. When a behavior occurs more often in the presence of a specific stimulus than in its absence. B. When a stimulus is used as a reinforcer. C. When a stimulus is used as a punisher. D. When a stimulus is removed to decrease a behavior. Answer. A. When a behavior occurs more often in the presence of a specific stimulus than in its absence. This question is about stimulus control, a core concept describing how cues in the environment tell us when a behavior is likely to lead to reinforcement. Stimulus control happens when a behavior is under the control of a specific environmental cue. A stimulus, for example, a child learns that asking for a cookie when mom is in the kitchen is likely to get a cookie, but asking when mom is on the phone in the living room is not. The presence of mom in the kitchen signals that the behavior, asking for a cookie, will likely be reinforced. The stimulus, mom in kitchen, controls the likelihood of the behavior. The cue matters. Question 14. When you are teaching a new skill using prompting, what is generally the goal regarding the prompts? A. To fade them out as quickly as possible. B. To keep using the same prompt consistently. C. To increase the level of prompting over time. D. To use the most intrusive prompt possible. Answer. A. To fade them out as quickly as possible. This question is about prompts and what you should do with them as the client learns. The purpose of prompting is to help the client make the correct response so they can be reinforced. but you don't want them to become dependent on your help. Fading means gradually reducing or eliminating the prompt as the client starts to respond correctly on their own. The goal is for the client to perform the skill independently, without your help, so you fade the prompt to transfer control from the prompt to the natural cue, SD. Prompts are temporary help. The goal is independence. Question 15. What is positive reinforcement? A. Taking away something unpleasant to increase a behavior. B. Giving something pleasant to increase a behavior. C. Taking away something pleasant to decrease a behavior. D. Giving something unpleasant to decrease a behavior. Answer. B. Giving something pleasant to increase a behavior. This question defines positive reinforcement, a fundamental principle of behavior change. Positive means adding something, and reinforcement means increasing the future likelihood of the behavior. So, positive reinforcement is when you add a stimulus, usually something the client likes, after a behavior occurs, and as a result, the behavior becomes more likely to happen again. Giving a child a sticker, adding something after they share a toy makes sharing the behavior more likely in the future. Positive means add, reinforcement means increase. Question 16. If a client refuses to participate in a scheduled activity, what is the first thing you should do according to most behavior plans? A. Terminate the session immediately. B. Force the client to participate. C. Refer to the behavior plan for specific instructions on non-compliance. D. Give the client a different preferred activity. Answer. C. Refer to the behavior plan for specific instructions on non-compliance. This question addresses what to do when a client shows non-compliance. Behavior plans often include specific strategies for handling situations like refusal or non-compliance. Your first step isn't to guess or try something random. It's to consult the document created by your supervisor that tells you exactly what procedure to follow for this client in this situation. The plan might say to use a specific prompt, implement a consequence like a brief pause in the activity, or follow a specific extinction procedure. Always follow the plan. The plan is your guide. Question 17. What is the primary difference between continuous measurement and discontinuous measurement? A. Continuous measurement is easier to do than discontinuous measurement. B. Continuous measurement captures every instance of a behavior, while discontinuous measurement captures only a sample. C. Discontinuous measurement is used for skills, while continuous measurement is used for behaviors. D. There is no significant difference. They are interchangeable terms. Answer. B. Continuous measurement captures every instance of a behavior, while discontinuous measurement captures only a sample. This question asks about the difference between two main types of measurement. Continuous measurement, like frequency or duration, involves recording every single time the behavior happens or how long it lasts from start to finish. Discontinuous measurement, like interval recording, partial or whole, or momentary time sampling, involves checking for the behavior only during specific moments or intervals, not the whole time. It gives you an estimate, not a complete count. Think of counting every raindrop, continuous, versus checking if it's raining every 5 minutes, discontinuous. Continuous captures everything. Discontinuous captures a sample. Question 18. An RBT is working on teaching a client to request for items. Man training. The client sees a toy car and says, car. The RBT gives the client the toy car. This is an example of reinforcing. A. An echoic. B. Attacked. C. An introverbal. D. A mand. Answer. D. A mand. This question is about verbal behavior, specifically different types of language responses. A mand is a request. The client asks for something they want, and the reinforcement is getting that specific thing. In this example, the client wants the car, says car, the response, and gets the car, the reinforcement because it fulfills the desire. An echoic is repeating what someone else says. A tact is labeling something you see or hear, and an intraverbal is responding to someone else's words, like answering a question or filling in a blank. This was a request, so it's a mand. Mands are requests. Question 19. What is the purpose of a visual schedule for a client? A. To punish problem behaviors. B. To provide a predictable structure and transitions throughout the day. C. To teach the client to read. D. To assess the client's preferences. Answer. B. To provide a predictable structure and transitions throughout the day. This question asks about the function of a visual schedule. Visual schedules use pictures or words to show a client what activities will happen and in what order. This provides predictability, which can be very helpful for clients who struggle with transitions or understanding what's coming next. It helps them anticipate changes and understand their routine. It's not for punishment, teaching reading, though it can involve words, or assessing preferences. It's a tool for structure and predictability. Visual schedules help clients know what to expect. Question 20. What does it mean to be a mandatory reporter? A. You are required to report your work hours weekly. B. You are legally required to report suspected child abuse, elder abuse, or neglect. C. You must report all client progress to the supervisor daily. D. You are required to report any behavior that occurs during a session. Answer. B. You are legally required to report suspected child abuse, elder abuse, or neglect. This question covers a crucial ethical and legal responsibility for RBTs. As an RBT, you are typically considered a mandatory reporter, meaning you are legally obligated to report any suspicion of abuse or neglect involving children or vulnerable adults to the proper authorities. You don't need definitive proof, just a reasonable suspicion. This is a serious responsibility to protect vulnerable individuals. You must know and follow the reporting procedures in your area and always inform your supervisor if you make a report. Protecting clients is paramount, and reporting suspected harm is a legal duty. Question 21. When using positive reinforcement, how quickly after the behavior should the reinforcer be delivered? A. Within 1 hour. B. Within 10 minutes. C. Immediately, within a few seconds. D. By the end of the session. Answer. C. Immediately, within a few seconds. This question is about the timing of reinforcement, which is critical for effective teaching and behavior change. For reinforcement to be most effective, especially when teaching new skills or behaviors, it needs to be delivered immediately after the desired behavior occurs. This helps the client make a clear connection between their action and the reward. A delay can make it unclear what behavior was actually reinforced, making learning slower or ineffective. Strike while the iron is hot, reinforce immediately. Question 22. Which of the following is not a function of behavior? A. Attention. B. Escape/avoidance. C. To get a tangible item. D. Diagnosis. Answer. D. Diagnosis. This question asks which option is not a reason why a behavior occurs. Its function. Functional assessments look for the purpose of a behavior, and the common functions we identify are getting attention from others, escaping or avoiding something unpleasant, getting access to a tangible item or activity, or gaining automatic reinforcement, sensory input that feels good. A client's medical or educational diagnosis, like autism spectrum disorder, is a label or classification, not the function of a specific behavior like screaming or hand flapping. Diagnosis tells you what a person has, not why they do a specific behavior. Question 23. What is the purpose of a baseline data collection? A. To show how much progress the client has made. B. To determine the client's preferred reinforcers. C. To get a measure of the behavior before an intervention is implemented. D. To see if the intervention has been successful. Answer. C. To get a measure of the behavior before an intervention is implemented. This question asks about baseline data. Baseline data is like taking a before picture. It measures how often, how long, or under what conditions a behavior or skill occurs before you start trying to change it with an intervention. This provides a starting point or comparison, so you can later see if your intervention had an effect. You need to know where you started to see if you've made progress. Baseline is the before picture of the behavior. Question 24. What is the most appropriate way to communicate with your supervisor if you have questions about a behavior plan? A. Guess what to do based on your best judgment. B. Ask another RBT what they would do. C. Document your question and wait for your next scheduled supervision meeting. D. Contact your supervisor according to the communication method they have specified, example, phone call, email, scheduled meeting. Answer. D. Contact your supervisor according to the communication method they have specified, example, phone call, email, scheduled meeting. This question is about professional communication with your supervisor, which is essential for effective and ethical practice. If you have questions about a client's plan, it's crucial to get clarification from the person who designed it, your supervisor. They will have specific ways they prefer to be contacted, like email, phone, or using a specific communication app, and specific protocols for urgent views, non-urgent questions. Never guess when it comes to implementing a plan. Always seek clarification from your supervisor using their preferred method. When in doubt, ask your supervisor. Question 25. What does the term prompt dependency mean? A. The client prefers to use prompts. B. The client can only perform a skill when a prompt is provided. C. The RBT relies too much on prompts. D. The client gets reinforcement for using prompts. Answer. B. The client can only perform a skill when a prompt is provided. This question defines prompt dependency, which happens when a client becomes reliant on prompts to perform a skill and cannot do it without the prompt. The goal of prompting is to help the client respond correctly so you can reinforce it, eventually leading to independent performance. If you don't fade prompts effectively, the client might only respond when you prompt them, showing they depend on your help rather than the natural cue. This means you haven't successfully transferred stimulus control from your prompt to the intended SD. Dependency on prompts prevents independence. Question 26. When teaching a new skill, what is discrimination training? A. Teaching the client to tell the difference between two or more stimuli. B. Teaching the client to discriminate against certain people. C. Teaching the client to ignore all distractions. D. Teaching the client to respond randomly. Answer. A. Teaching the client to tell the difference between two or more stimuli. This question asks about discrimination training, a key part of teaching many skills. Discrimination training is teaching the client to respond differently to different stimuli. For example, teaching a client to touch the red block when you say touch red, but not to touch the red block when you say touch blue. They are learning to discriminate between the instruction touch red and touch blue and respond correctly to each specific cue. It's about responding appropriately to the right signal. Discrimination is about telling things apart and responding correctly to the right cue. Question 27. What is a token economy? A. A system where clients earn tokens for specific behaviors that can be exchanged for reinforcers. B. A method for saving money. C. A type of punishment system. D. A way to track how many behaviors occur. Answer. A. A system where clients earn tokens for specific behaviors that can be exchanged for reinforcers. This question defines a token economy, a commonly used reinforcement system. In a token economy, clients earn generalized conditioned reinforcers, tokens, points, stickers for engaging in target behaviors. These earned tokens can later be exchanged for a variety of preferred items or activities. Backup reinforcers. It's a way to provide frequent, immediate reinforcement that bridges the gap to larger, delayed rewards. Think of earning points for good behavior that you can trade in for extra video game time later. It's a system for earning rewards. Question 28. if a behavior occurs and is immediately followed by the removal of a preferred stimulus, and as a result, the behavior decreases in the future, this is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: D. Negative punishment. This question asks you to identify a type of consequence based on its effect on future behavior. Remember, negative means removing something and punishment means the behavior decreases. So, negative punishment is when you remove a stimulus, something preferred or neutral, after a behavior occurs, and this removal makes the behavior less likely to happen again. If a teenager stays out past curfew behavior and gets their phone taken away for a week, removal of preferred stimulus, and they are less likely to stay out past curfew in the future, this is negative punishment. Remove something to decrease behavior. Question 29. Which ethical principle requires RBTs to avoid relationships with clients or their families that could impair their objectivity or judgment? A. Beneficence, doing good. B. Fidelity, being truthful. C. Justice, fairness. D. Avoiding multiple relationships and conflicts of interest. Answer: D. Avoiding multiple relationships and conflicts of interest. This question is about a specific ethical guideline. RBTs must maintain professional boundaries. Having a multiple relationship means having more than one type of relationship with a client or their family, example being their therapist and their friend, or their RBT and their babysitter. These can create conflicts of interest and make it hard to remain objective and professional. You should only have a professional relationship with clients and their families to ensure you can provide the best, unbiased care. Keep your relationships professional. Question 30. What is the purpose of generalization in skill acquisition? A. To teach the client to perform the skill only in the therapy room. B. To ensure the client can perform the skill in different settings, with different people, and with different materials. C. To teach the skill more quickly. D. To decrease the frequency of the skill. Answer: B. To ensure the client can perform the skill in different settings, with different people, and with different materials. This question asks about generalization, which is about a skill happening in more places or ways than it was originally taught. We don't want clients to only perform a skill, like saying hello, with one RBT in one room. We want them to say hello to different people, generalization across people, in different places, generalization across settings, and maybe even in slightly different ways, generalization across responses, like hi or hey. Generalization means the skill is useful and happens in the real world, not just during structured therapy time, making skills useful everywhere. Question 31. What does operational definition mean in behavior analysis? A. Describing a behavior using complex psychological terms. B. Defining a behavior in a clear, objective, and measurable way. C. Guessing why a behavior is happening. D. Labeling a behavior with a diagnosis. Answer: B. Defining a behavior in a clear, objective, and measurable way. This question defines an operational definition, which is essential for accurately measuring and tracking behavior. An operational definition describes a behavior exactly as you see and hear it, using only observable actions. It's so clear that two different people observing the same person would agree on whether the behavior happened or not. Instead of saying the child had a meltdown, an operational definition might be the child screamed, fell to the floor, and hit their head with an open palm. It's about being specific and objective. Define behavior so everyone knows exactly what you're looking for. Question 32. What is the difference between a motivating operation, MO, and a discriminative stimulus, SD? A. An MO signals when reinforcement is available. An SD changes the value of a reinforcer. B. An MO changes the value of a reinforcer and increases or decreases the likelihood of behaviors that have led to that reinforcer. An SD signals when reinforcement is available if a specific behavior occurs. C. An MO is a type of prompt. An SD is a consequence. D. There is no difference. They are the same thing. Answer B. An MO changes the value of a reinforcer and increases or decreases the likelihood of behaviors that have led to that reinforcer. An SD signals when reinforcement is available if a specific behavior occurs. This question asks you to distinguish between two important environmental factors that influence behavior. A motivating operation, MO, makes a reinforcer more or less valuable and makes behaviors that use to get that reinforcer more or less likely. For example, being really thirsty, MO, makes water very reinforcing and makes you more likely to ask for water. A discriminative stimulus, SD, is a signal that tells you reinforcement is currently available for a specific behavior. Seeing a water bottle, SD, tells you that asking for water right now might get you water. MO changes value/frequency. SD signals availability. MO makes you want it. SD tells you how to get it now. Question 33. When documenting session notes, what is important to include? A. Detailed personal opinions about the client's family. B. Objective observations of client behavior, progress on goals, and any issues that arose. C. Subjective interpretations of why the client did something. D. Information about other clients you worked with that day. Answer B. Objective observations of client behavior, progress on goals, and any issues that arose. This question is about proper documentation. Session notes are professional records of what happened during your session. They should be objective, just the facts, what you saw/heard. Describe progress on the client's goals, and note any important behaviors or events, including your actions. Avoid personal opinions, interpretations of feelings, or information about unrelated individuals. Your notes should accurately reflect the session and be easy for others on the team to understand. Stick to the facts and the plan in your notes. Question 34. What should you do if a client's parent asks you to implement a procedure that is not in the behavior plan? A. Agree to try it if it seems harmless. B. Tell the parent that's a bad idea. C. Explain that you can only implement procedures in the plan and will discuss their suggestion with your supervisor. D. Implement the procedure but don't tell your supervisor. Answer C. Explain that you can only implement procedures in the plan and will discuss their suggestion with your supervisor. This question tests your understanding of your role and ethical boundaries regarding client plans. As an RBT, you are trained to implement the plan created by your supervisor. You cannot make changes or add new procedures, even if requested by a parent. This ensures the plan is implemented correctly and consistently. Politely explain that you must follow the approved plan and will relay their suggestion to your supervisor, who can consider it. It's important to be respectful but firm about following the protocol. Your supervisor is the clinical decision maker. Question 35. How is a crisis plan different from a standard behavior plan? A. A crisis plan is only for parents to use. B. A crisis plan outlines procedures for dangerous or emergency situations. C. A crisis plan is used for teaching new skills. D. A crisis plan is created by the RBT. Answer B. A crisis plan outlines procedures for dangerous or emergency situations. This question asks about crisis plans. While a standard behavior plan addresses everyday behaviors, a crisis plan is specifically designed for situations where the client's behavior poses a risk to themselves or others, example, severe aggression, self-injury. It provides clear, step-by-step instructions on how to safely manage the situation to ensure everyone's safety. You must be trained on and know your client's crisis plan if they have one. Crisis plans are for safety in emergencies. Question 36. What is the primary purpose of supervision for an RBT? A. To make sure the RBT is always busy. B. To provide support, guidance, and oversight to ensure competent and ethical service delivery. C. To assign new clients to the RBT. D. To complete the RBT's performance review. Answer: B. To provide support, guidance, and oversight to ensure competent and ethical service delivery. This question is about the purpose of supervision, which is a requirement for maintaining RBT certification. Supervision is crucial for your professional growth and for ensuring clients receive high-quality care. Your supervisor mentors you, helps you troubleshoot issues, checks your implementation of plans, and ensures you are practicing ethically. It's about getting the support and guidance you need to do your job well and safely. Supervision helps you be the best RBT you can be. Question 37. When using a shaping procedure, what is being reinforced? A. Only the final target behavior. B. Any behavior the client engages in. C. Successive approximations of the target behavior. D. Behaviors that are different from the target behavior. Answer: C. Successive approximations of the target behavior. This question asks about shaping, a method used to teach new behaviors by reinforcing steps towards the final goal. Shaping involves reinforcing behaviors that are closer and closer, successive approximations, to the desired target behavior, while no longer reinforcing earlier steps. If you're shaping a child to, say, bubble, you might first reinforce ba, then ba, and finally bubble. You reinforce the progress towards the goal. Shaping is about reinforcing steps in the right direction. Question 38. What is the difference between positive and negative reinforcement? A. Positive reinforcement is good. Negative reinforcement is bad. B. Positive reinforcement adds a stimulus. Negative reinforcement removes a stimulus. Both increase behavior. C. Positive reinforcement increases behavior. Negative reinforcement decreases behavior. D. Positive reinforcement is used for skills. Negative reinforcement is used for behaviors. Answer: B. Positive reinforcement adds a stimulus. Negative reinforcement removes a stimulus. Both increase behavior. This question asks you to compare positive and negative reinforcement. Remember, positive means adding something, negative means removing something. Both positive and negative reinforcement increase the future likelihood of the behavior they follow. Positive reinforcement adds something desired, like praise or a toy, to increase behavior. Negative reinforcement removes something undesired, like an unpleasant task or loud noise, to increase behavior, like finishing the task quickly or asking for quiet. Both types of reinforcement make behavior happen more often. Add or remove, but behavior goes up. Question 39. Which type of data collection is best for measuring behaviors that occur at a high rate, like hand flapping? A. Duration. B. Frequency. C. Partial interval recording. D. Latency. Answer: C. Partial interval recording. This question asks about the best measurement method for high-rate behaviors. While frequency is counting, it can be hard to get an exact count of a behavior like rapid hand flapping that happens constantly. Duration measures how long it lasts. Latency measures the time to start. Partial interval recording is a discontinuous method where you divide the session into intervals and simply mark if the behavior occurred at any point during that interval, regardless of how many times or how long. This gives a good estimate for behaviors that are hard to count every single instance of. For fast, frequent behaviors, sampling with interval recording is often easier. Question 40. What is the ethical guideline regarding the least restrictive procedures? A. Always use the most powerful procedures first. B. Use procedures that are the least intrusive or restrictive while still being effective. C. Only use procedures that the client prefers. D. Avoid using any restrictive procedures. Answer: B. Use procedures that are the least intrusive or restrictive while still being effective. This question refers to a key ethical principle in ABA. When choosing interventions, especially for challenging behaviors, we should aim for the least intrusive or restrictive options that are likely to be effective. This means trying less intensive strategies first before resorting to more restrictive ones, like certain types of punishment or physical interventions. The goal is to use the mildest necessary approach that will still help the client achieve their goals safely and effectively. Start with the least restrictive option that works. Question 41. When conducting a preference assessment, you are trying to identify A. The function of a behavior. B. Stimuli that may function as reinforcers. C. The client's skill level. D. The client's medical needs. Answer. B. Stimuli that may function as reinforcers. This question loops back to preference assessments, a core assessment method. A preference assessment is all about figuring out what items or activities a client likes. Things a client likes are more likely to work as reinforcers. Things that increase behavior. Preference assessments help you identify potential rewards, not the reason for behavior, function, skill level, or medical needs. Finding out what clients like helps you motivate them. Question 42. What is task analysis? A. Breaking down a complex skill into smaller, manageable steps. B. Analyzing the function of a challenging behavior. C. Assessing a client's cognitive abilities. D. Choosing preferred items for reinforcement. Answer. A. Breaking down a complex skill into smaller, manageable steps. This question defines task analysis, a common strategy in skill acquisition. A task analysis is when you take a larger, complex skill, like washing hands or brushing teeth, and break it down into a sequence of smaller, easier-to-learn steps. You then teach the client each step, either one at a time or in a chain. It makes learning complicated skills much more manageable. Breaking it down into steps makes it easier to teach and learn. Question 43. What is a consequence in behavior analysis? A. Something that happens before a behavior. B. Something that happens after a behavior. C. A prompt or cue. D. A medical diagnosis. Answer. B. Something that happens after a behavior. This question defines a consequence. In behavior analysis, a consequence is simply anything that happens immediately following a behavior. Consequences can be reinforcers, which increase the behavior, punishers, which decrease the behavior, or have no effect. It's not about whether the consequence is good or bad, just that it occurs after the behavior and may influence whether that behavior happens again. Consequences follow behavior. Question 44. When should you contact your supervisor regarding a client's progress or lack thereof? A. Only during scheduled supervision meetings. B. When the client reaches a major milestone. C. When you notice significant changes in behavior, slow progress, or have concerns about the plan. D. Never, unless specifically told to. Answer. C. When you notice significant changes in behavior, slow progress, or have concerns about the plan. This question is about when to communicate important information to your supervisor. While you have scheduled supervision, you must also communicate issues or significant observations as they arise. If a client is making no progress, has a sudden increase in challenging behavior, or you feel unsure about how to proceed, you should reach out to your supervisor sooner rather than later. Don't wait if there's a problem or something important to report. Prompt communication helps the team make timely decisions. Question 45. What is the purpose of reinforcement schedules? Example, continuous, intermittent. A. To determine the function of a behavior. B. To decide which prompt to use. C. To control when and how often reinforcement is delivered. D. To assess the client's preferences. Answer. C. To control when and how often reinforcement is delivered. This question is about reinforcement schedules, which dictate when and how often reinforcement is given for a specific behavior. A continuous schedule reinforces every single instance of the behavior, which is great for teaching new skills. Intermittent schedules reinforce only some instances, based on time or number of responses, which helps maintain skills and make them more resistant to extinction. Schedules determine the pattern of reinforcement. Question 46. What is the difference between a fixed ratio, FR, and a variable ratio, VR, reinforcement schedule? A. FR reinforces after a set amount of time. VR reinforces after a changing amount of time. B. FR reinforces after a set number of responses. VR reinforces after a changing number of responses. C. FR is used for behavior reduction. VR is used for skill acquisition. D. There is no difference between FR and VR schedules. Answer. B. FR reinforces after a set number of responses. VR reinforces after a changing number of responses. This question tests your knowledge of specific reinforcement schedules. Both fixed ratio, FR, and variable ratio, VR, schedules are based on the number of responses. Ratio, not time, interval. The difference is whether that number is fixed or changes. An FR schedule reinforces after a set, predictable number of responses. Example, FR5 means reinforcement after every 5 responses. A VR schedule reinforces after a variable, unpredictable number of responses that averages out to a specific number. Example, BR5 means reinforcement on average after every 5 responses, but it could be 3, then 7, then 4, then 6. VR schedules tend to produce high, steady rates of behavior because the client doesn't know exactly which response will be reinforced. Ratio schedules count responses. Fixed means set, variable means changing. Question 47. If you are teaching a client to follow the instruction clap hands and you physically guide their hands together, what type of prompt are you using? A. Verbal prompt. B. Gestural prompt. C. Full physical prompt. D. Visual prompt. Answer. C. Full physical prompt. This question asks about identifying a specific type of prompt. When you use your hands to help the client perform the entire movement or action, it's called a physical prompt. Guiding their hands completely is a full physical prompt. A verbal prompt is telling them what to do, a gestural prompt is pointing or nodding, and a visual prompt uses pictures or objects. Using your hands to move the client's body is a physical prompt. Question 48. When working with a client, maintaining their dignity is important. What is one way to uphold a client's dignity? A. Talk about their behaviors in front of them using negative language. B. Allow them to make choices when possible. C. Ignore their attempts to communicate if they are not using words. D. Treat them like a young child regardless of their age. Answer. B. Allow them to make choices when possible. This question is about treating clients with respect and upholding their dignity. Allowing clients to make choices about toys, activities, order of tasks, etc., when appropriate, is a way to give them control and respect their autonomy. Talking negatively about them, ignoring communication attempts, especially nonverbal ones, or treating older clients like small children undermines their dignity. Treating clients with respect means valuing their voice and choices. Give clients choices when you can. Question 49. What is the ethical responsibility of an RBT if they witness their supervisor behaving unethically? A. Ignore it, as it is the supervisor's responsibility. B. Report it to the client's parents immediately. C. Discuss concerns with the supervisor first, and if unresolved, report to the appropriate authority, like the certification board or your company's compliance officer. D. Post about it anonymously online. Answer. C. Discuss concerns with the supervisor first, and if unresolved, report to the appropriate authority, like the certification board or your company's compliance officer. This question addresses another important ethical scenario. If you believe your supervisor is acting unethically, your primary responsibility is to the client and upholding ethical standards. The ethical guidelines usually recommend addressing the concern with the supervisor directly first, if possible and safe. If the issue is not resolved or cannot be discussed directly, you have an obligation to report it to the appropriate authority, such as the Behavior Analyst Certification Board, BACB, or your employer's compliance or ethics officer. Ignoring it or discussing it inappropriately, like online, is unethical. Follow the chain of command and professional reporting procedures. Upholding ethics is everyone's job. Question 50. What is the definition of a behavior in behavior analysis? A. A feeling a person has. B. A thought a person has. C. Anything a person says or does, observable and measurable actions. D. A diagnosis given by a doctor. Answer. C. Anything a person says or does, observable and measurable actions. This final question gets back to basics. What is behavior? In behavior analysis, behavior has a very specific definition. It's anything an organism does that can be observed and measured. This includes actions like walking, talking, eating, hitting, but also saying words or writing. Feelings and thoughts are not directly observable by another person, so they are not typically considered behavior in this definition, though they can be related to observable behaviors. A diagnosis is a label, not a behavior itself. Behavior is what you can see and measure.